Hello everyone, hope you're all well. My name is Dr. Shahryar and today we'll be talking about flu vaccine. But before I do that, I just want to briefly tell you what flu is. Flu is an infection that can cause fever, cough, body aches, and other symptoms. There are different forms of flu, including the seasonal flu. The vaccination I am talking about is regarding seasonal flu. The flu vaccine does not protect against bird flu, H1N1 flu, or COVID-19, coronavirus. Everyone has been talking about COVID-19. In the process, I do feel we have forgotten about flu. A few simple precautions that everyone can take to protect and avoid getting flu this year. There are already many people in the hospitals all over the world with COVID-19. If we do not take precautions with regards to flu, then we might end up getting the infection and overburden the medical system that is already under a lot of stress. Before I talk about the vaccine, a few simple ways to protect yourself from getting flu. By washing your hands often with soap and water or using alcohol hand sanitizer. Staying away from people you know are sick. And also to protect others, you should stay at home if you get the flu. Do not go to work or school until your fever has gone for at least 24 hours without taking fever-reducing medicine such as Tylenol or acetaminophen. If you work in a healthcare setting, taking care of patients, you might need to stay home longer if you are still coughing. Cover your mouth and nose with the inside of the elbow when you do cough or sneeze, like this. We have to behave as responsible human beings and not only take care of ourselves, but also of the people around us and our environment. Flu vaccine comes in two different forms. A shot that goes into the muscle, usually in the upper part of the arm, somewhere here, or as a nasal spray. Flu vaccine should be given to all people aged between 6 months or older every year, especially certain people who are in the high-risk group. Now, who are these high-risk individuals? Well, children age 6 months through 4 years, adults age 50 or older, people with long-term health problems such as lung disease, including asthma or COPD, heart disease, diabetes, severe obesity, people who have trouble fighting infections. For example, if they are being treated for cancer, or if they have HIV, AIDS, if they've had an organ transplant. Also women who are or will be pregnant during the flu season. People who live in nursing homes or long-term care facilities. All of them need the flu vaccine. Ask your doctor if you're in the high-risk group. The best time of the year to get the flu vaccine is before winter season begins. In United States, the best time is to get vaccinated by October, or as soon as you can. Do your best to get the vaccine soon after it becomes available in your area. Benefits of getting the flu vaccine: well, it keeps you from getting sick from flu. If you are vaccinated, you will protect other people around you from getting sick as well. That's known as herd immunity. Sometimes people do ask that if you get the vaccine, can you still get the flu? The answer is yes, and this is why some people might say that the flu vaccine does not work. That is not correct. It works, and even if one gets the flu, the severity and duration of the flu will be less. It will protect you from dying from flu. Yes, flu can kill. Also, one needs to differentiate between common cold and flu. Flu vaccine does not protect against common cold, and sometimes people do get a common cold and they think it's flu. Flu is also different from COVID-19 coronavirus, and the flu vaccine does not protect against COVID-19 coronavirus. Side effects of flu vaccine are redness, mild swelling, or soreness where you got the shot, if you got the shot, mild fever, mild rash, headaches, or body aches. Vaccines can also sometimes cause more serious side effects, such as severe allergic reactions. But serious side effects are rare and do not always happen. You can always discuss these serious side effects with your doctor. Does the flu vaccine cause flu? The answer is no. The flu vaccine does not cause the flu. People sometimes feel sick after getting the vaccine, but this is often because they were already starting to get sick with the flu or another virus before they had the vaccine. There was always concern that there was a concern that flu vaccine caused autism, but after doing many careful studies, scientists have not found any link between vaccines and autism. Many years ago, a study reported a link between autism and vaccines, but that study turned out to be false and has been withdrawn. If you are pregnant, it is very important to get the flu vaccine. In pregnant women, flu symptoms can get worse quickly and can be very dangerous. The flu can even cause trouble breathing or lead to death of the woman or her baby. That is why it is so important to get the flu vaccine if you are or will be pregnant during the flu season. People sometimes worry about having egg allergies. That's because some form of the flu vaccines do contain small amount of egg. But the amount is so small that it does not cause an allergic reaction. If you have egg allergies, you should still get the flu vaccine, and you can always discuss it with your doctor before you get the vaccine. Thank you for listening. And now about the quote of the day. Accept the apology even if it is not sincere. Accepting an apology and forgiving the other person is more for yourself than for the individual apologizing, even though he's not sincere. When you forgive someone, and I mean when you completely forgive someone, you stop thinking about what he did wrong to you. You stop reminding him of what he did wrong to you. And you stop thinking about the whole event. When you do that, and believe me, it's not easy, but if and when you do that, you let go of a lot of stress and anger that has been inside of you. Letting go of stress and anger helps you feel more relaxed and be more happy. This helps you become a better person. Thank you for listening. I hope you stay safe. Take care, and bye-bye.
If you liked the video, please subscribe, like and share.